Thank you. And for over a decade now, I've had the privilege of working closely with and learning from many of our partners across the country, including a growing number of community health centers. It's wonderful to see so many longtime friends and new faces. We encourage everyone to share your thoughts and ask lots of questions in the chat. Please don't be shy. And after the call, we'll share the slides and the recording and a bunch of resources for you to dig into deeper, everything that we talk about today. So today's webinar is a 1-hour glimpse as part of an ongoing series that explores the real-world application of our tools grounded in the stories and insights of leaders like you. Today, we're going to share a new resource that we've co-developed with partners at the Northwest Regional Primary Care Association, Community Initiatives, Institute for People, Place, and Possibility, and most importantly, six community health centers from across Alaska, Washington, and Oregon. And you'll get to hear from them. You'll get to hear from Seth Doyle from the Northwest Regional Primary Care Association and Nalani Tarrant from the National Association of Community Health Centers about their efforts to help support community health centers across their region and across the country. And from Lisa Aquino from Anchorage Neighborhood Health Center in Alaska and Christine Winters from Rogue Community Health in Oregon about how they're building partnerships, investing in community health, and reimagining what's possible. So just a quick note about who we are at Rippel and why we're here putting this on today. For me and my colleagues, what motivates us to show up at work every day is a deep belief in a future where all people and places can thrive, no exceptions. We're joining with others from all across the country to live into that unifying and measurable expectation. And we know that even with systems that are fraught with injustices that we see everywhere and the divides that are fracturing how we understand one another, we can transform the systems if enough of us commit to thinking and working in different ways together. We call this shared stewardship. And we see our role as helping to energize this growing movement of thriving together through shared stewardship. For us, the why of the work is, as I said, all people thriving together, no exceptions, and really understanding who's struggling, who's suffering, and who's thriving in our communities. The what is about the conditions of the places we all live and the power that we hold over our own lives. The vital conditions for health and well-being, including meeting our basic needs for health and safety, opportunities for lifelong learning and meaningful work and wealth, access to humane, affordable housing, reliable transportation, and a thriving natural world, as well as a sense of belonging, valued for who we are and what we bring, and the civic muscle that we know is so important for people and communities to shape the world together. And lastly, the how is the ways of thinking and acting together that help us build these vital conditions, the practices that support collaborating, adapting, and building the relationships and trust that we know are so foundational to this work. We call that shared stewardship. And you can see across this map, we're witnessing the incredible work that's happening across the country and the real momentum that's growing, the organizations and partnerships that see themselves as stewards that are helping communities thrive together. At Rippel, we're deeply committed to understanding what helps stewards on the front lines to be more impactful, to come together in different ways, and to sharing those stories in order to make this growing movement more visible. And a growing number of community health centers are joining this work as they are natural catalysts for the movement to thrive together. These community health centers are fostering a shared vision of thriving with community partners and developing solid plans for investing in community health. And we're going to hear from them shortly, but before we do, let's just take a quick poll of who's in the room. Are you joining from a community health center? Are you a partner of community health centers? Are you interested in partnering more? Or are you just here to learn more? All right, let's see. Okay. Almost got everybody. Couple more seconds here. All right, so looks like we have a whole bunch of people who are partnering with community health centers, which is great. A couple community health centers themselves, and a lot of folks who are interested in partnering further. And this is great because we know, while the focus is community health centers today and their critical work in communities, we know they don't do this work alone. They should not do this work alone. And so it's important to see so many folks from different organizations and sectors joining today. Okay, so with that, I'm going to hand it over first to Nalani from the National Association of Community Health Centers to tell us a little bit more about the national landscape, what's happening, and I'll hand it over to Nalani now. And you can tell me when to move the slides.
Oh, great. Awesome. I was just going to ask that. Thanks so much, Anna. And it's a pleasure to be here with you all. So I'm going to start off by talking a little bit more about who NACC is, or who the National Association of Community Health Center is. We are the leading voice and advocate for community health centers, which include federally qualified health centers and lookalikes. So for more than 5 decades, health centers have been at the forefront of delivering care to underserved communities nationwide. And at NACC, our mission is to champion community health centers as they deliver affordable, effective, and comprehensive primary care. This care is not only high quality, but also community driven, ensuring services are responsive to local needs while working to improve health for all. And by staying true to this mission, we move closer every day to our vision, where we have healthy and thriving communities across the country, where everyone has access to exceptional primary care, no matter their income, their background, or their geography. And it's for that reason that we here at NACC have embraced the vital conditions framework. Yes, health centers have addressed social needs at the individual level every day, helping patients with resources such as food, housing, or transportation, to name a few. But through this particular framework and lens, we can go one step further. It helps us look beyond the exam room, not just at the individual or micro level, but also at that community macro level to address the root causes that help shape the health and well-being of our communities. And by using this lens, health centers can then better be equipped to strengthen partnerships with schools, food banks, housing authorities, or local businesses to leverage funding and policy opportunities that align with long-term community health goals, and to also to measure and demonstrate structural change across the sectors that are within the vital conditions framework. Next slide. So this slide provides an overview of community health centers. As we know, health centers are on the front lines of providing high quality, affordable, comprehensive, and integrated primary care into the communities across this country. They're not just healthcare providers, they are the community anchors. Today, about 1 in 10 people in the US are health center patients. And in fact, in 2024 alone, health centers served a record-breaking of 33.9 million patients. What's important to note is that health centers are committed to serving all patients, regardless of background, income, or insurance status. And the numbers here tell that story. We saw in 2024 alone that 18% of patients are uninsured, while 59% are publicly insured. 90% of these patients have low income, and 64% are people of color. Yet every single one has a home at a community health center. Ultimately, health centers are more than places than just a place to receive care. They are the trusted healthcare home for so many of our communities, including people who are experiencing homelessness or houselessness, children, veterans, and older adults. They're both the providers and partners that are delivering care that is rooted in trust, accessibility, and community. And that really goes hand in hand with the essence of the vital conditions framework. Next slide. So at NACC, we see the vital conditions framework as a way to build upon the traditional social drivers of health or non-medical clinical factors approaches. It provides that roadmap for designing and measuring structural change across these 7 sectors that you see on the screen. Most importantly, this framework is helping to shift our perspective from focusing on only problems to identifying opportunities, from reacting to disparities to proactively creating the conditions where people and communities can truly thrive. And health centers are essential because they bridge medical care with community well-being. Every day, health centers are connecting patients to resources, as I mentioned before, whether it's food, housing, transportation, work, training, etc. They're meeting those needs beyond the exam room, beyond those clinical needs. And through the Vital Conditions Framework, health centers can now expand this impact from individual support to really community transformation. As trusted anchors at the intersection of health and community, they are uniquely positioned to partner across sectors, drive equity, and build the conditions where everyone has that opportunity to thrive. So, really, in short, the vital conditions framework for us that we see is really to help empower health centers to not only treat illnesses, but to build conditions for well being, ensuring lasting impact to the communities for generations. Next slide. So I'll wrap up with two things here with where NAC is going with this. First, NAC has launched several centers of excellence, with one being the Center of Vital Conditions. This reflects our commitment to supporting health centers as they not only deliver care, but also strengthen the community conditions that shape health. And secondly, we are excited to announce that we are launching and standing up a Vital Conditions Committee. So this committee will guide our work at a national level, ensuring that health centers' voices are at the table to help align strategies across the sectors in the Vital Conditions Framework. And really the goal of these two is to move from isolated efforts to a coordinated movement, one that positions health centers really at the forefront and at the center as a catalyst for equity, innovation, and thriving communities. And with that, that wraps up my quick portion of today's presentation. So I'll go ahead and hand things back over to Anna, and I look forward to the Q&A.
Thanks, Nalani. Yeah, and it's so exciting to see this work evolve at the national level and excited to see where it goes next. Now I'll hand it over to Seth, who has been leading some efforts in the country using the Vital Conditions Framework and Community Health Centers innovation. So, Seth.
Great. Thanks so much, Anna. And hi, everyone. It's great to be with you all here today. And so I'm with the Northwest Regional Primary Care Association. We're a membership organization for community health centers in the Northwest and Region 10. So that's Washington, Oregon, Idaho, and Alaska. And I'm going to share a little bit about how we got involved in the vital conditions work and a bit about a project that we did in partnership with Rippel Foundation and others, including 6 health centers from our region. But before getting into that, I want to back up just a moment here and share a story about one of the health centers in our region, a health center in Oregon, and how they came to be. This is the Virginia Garcia Memorial Health Center, and some of you may know this clinic and know their history. So Virginia Garcia started 50 years ago in 1975, and how they got started is both a tragic and yet also inspiring story. Virginia Garcia was a 6-year-old girl with a migrant who lived with a migrant farm worker family. She was traveling with her parents from Texas to Oregon, and along the way, she cut her foot, and she was unable to access medical care. And as a result, what was really something that should have been easily treatable led to her becoming very sick and eventually dying. And this happened in a small town outside of Portland, Oregon, in Cornelius. And the community rallied, and they decided that that's an injustice that they can't see again in their community. And they felt that it's important that people be able to have access to care regardless of who they are, regardless of whether they're from a farm worker family or not, whether they speak English or not. And so what started as Virginia Garcia 50 years ago was a clinic in a 3-car garage, and worked primarily as a clinic serving the migrant and farm workers that are in that area. And today it's one of the largest health centers in the state of Oregon, has multiple primary care clinics across 2 counties, many dental clinics, behavioral health, school-based health centers. And so I share that story because it's again, a powerful example of what's possible when a community can come together and address that type of injustice. And in many ways, it's the story of the health center movement, right? When we're reflecting right now in 2025 on 60 years of the community health center movement, we know its origins and how it came out of the civil rights movement. And within health centers, there's always been this understanding that health is more than healthcare. and it's necessary to get outside the walls of the clinic, go upstream, address those social drivers of health. And the vital conditions framework is a great framework that really allows us to continue to expand upon that work and think about ways that we can continue to address some of those social needs where they begin. So in terms of how we got started in this work, a couple of years ago was when we were introduced to the vital conditions. And I know that myself and others at NWRPCA were immediately excited by this framework and how we could work with health centers in our region to apply it. And so we had a pilot project that we did in 2023, 2024. Over the course of 9 months, we worked with the Rippel Foundation, community initiatives, the Institute for People, Place, and Possibility, and then the 6 health centers that you see here on this slide: Yakima Neighborhood Health and Family Health Centers in Washington, Rogue Community Health, Siskiyou Community Health Center, and the Community Health Centers of Lane County in Oregon, and then also Anchorage Neighborhood Health in Alaska. And so you'll hear today from folks from Rogue Community Health and Anchorage Neighborhood Health, and we're looking forward to hearing from them. And what we did over the course of that 9 months was we came together in person a couple of times, and we also met virtually over that span. And we really looked at how we can leverage the vital conditions framework in a way that health centers can really apply it to the work that they're doing, both internally within their organizations and externally with their partners. And so it was a really great learning opportunity for all of us that were involved in this. And I'm excited to hear more from Rogue and Anchorage today about sharing how, some of the specific work that they're doing in this space. So we can go to the next slide. So one of the resources that we've developed, as Anna mentioned earlier, as a result of this project is this Community Health Centers, a primer for advancing thriving people and places. And this is a resource that I hope all of you will have an opportunity to look at and will find useful. And what we really identified through this project and through the primer was a sense that community health centers don't have to do everything, right? And I think a lot of times there is a lot of pressure on health centers. We experienced that certainly during the pandemic, in this sense that, all of a sudden health centers had to be, really operating in this public health space. And so there's this sense of, health centers are constantly asked to do more and more and more and more, right? And this, what we really explored through this innovation lab is that what's possible when you leverage some of these principles of multi-solving and shared stewardship, working in collaboration with community members and other community partners, is that there are opportunities to achieve goals. And so that was one of the big learnings from the innovation lab, is just that sense of really being able to work more closely with community partners and leverage, again, that shared stewardship model to help advance the work. And then another key thing that I want to call attention to is this idea of moving from business as usual to then seeing a shift to achieve a new desired state. And what we talked a lot about as part of that work is this idea of, we spend a lot of time looking at the urgent services, right? Looking at the need to address access to healthcare, certain things that come up in the moment. And it doesn't really allow for us to take the time to look at what are the vital conditions overall. And so, Nalani referenced, for example, some of the unmet social needs that health centers are involved in addressing, things like food insecurity or housing. And those are things absolutely that health centers do each and every day. And one of the challenges there, though, is that it can oftentimes feel like we're just putting a Band-Aid on a problem, right? That by just addressing an unmet social need in the moment and not really being able to step back and examine what are the root causes of this. And so this was also something that was a key learning coming out of the innovation lab and our work around the vital conditions, was how can we really move from that business as usual to more of that desired state where we can address the vital conditions more holistically. So the last thing that I'll share on this last slide is just, there's a couple of quotes from 2 of the health centers that participated in this. And what I really want to focus on here and draw out of these quotes is the power of communication and narrative. We also talked a lot about that over the course of the Innovation Lab, and we all know it. We live in a deeply polarized and politicized world, and but the notion that all people should have the opportunity to thrive, that should not be a controversial topic or a concept, right? And so the vital conditions framework for us, it gives us a new way of talking about this work in a way that hopefully is accessible to everyone, regardless of what their ideology might be, and something that everyone can support and get behind. So with that, I think we're excited to be able to hear from the two health center partners that are on the call today, who will talk more about their experience with the vital conditions and how they're applying this work in the communities that they serve.
Wonderful. Thanks, Seth. Yeah, so with that, I'm going to hand it over to Lisa to talk about her work in Anchorage, and then we'll hear from Christine. They'll give brief overviews, high level what their work doing, and then we'll have a little bit of a discussion to dig in deeper. So Lisa.
Great. Hi, everyone. I'm so happy to be here and really, really honored, as well as, I just got to say, excited. I mean, if there's one takeaway I hope we all have after this is just how exciting and engaging and wonderful it is to talk about something as big as the vital conditions framework, but also as like meaningful and connected that is to all of us. So thanks. I'll go to the next slide, please. So my name's Lisa Aquino, and I'm from the Anchorage Neighborhood Health Center, and I'm the CEO here. I've been here for about 3.5 years, so I know that's not very long in terms of leadership at a health center. I've met leaders who've been there for decades, and they're so amazing. But I have loved the Anchorage Neighborhood Health Center for as long as I've lived here, and that's my whole life. Anchorage Neighborhood Health Center is a community health center here in Anchorage. We are the oldest health center in Alaska. We just had our 50th anniversary last year, and we are also the largest, certainly in Anchorage, which is the largest population hub here in Anchorage, or here in Alaska. We provide comprehensive, high-quality healthcare, and our mission as an organization is to be a trusted partner in every person's wellness by providing integrated, compassionate, and high-quality healthcare, regardless of ability to pay. So even in that, we are really calling out that commitment to overall wellness, but we definitely we see ourselves as being able to provide the highest quality care. We have integrated care. We have integrated behavioral health and clinical pharmacy. We have a single site here in Anchorage, and it's really a one-stop shop. As you can see, last year we saw just over 15,000 unique patients, and that's in a town of about 275,000 people total. So just to give you a sense. Also, it's a very diverse town, Anchorage, and so we translated over 55 languages and growing. It might be interesting to know that one of our zip codes here in Anchorage is perhaps one of the most diverse in the nation. I think that's surprising to a lot of people. We are committed to providing high quality care in every single way. So we really try to make that as easy as possible. We have on-site lab and x-ray. We have an in-house pharmacy, and we also are a 340B pharmacy and partner with pharmacies, every pharmacy in town nearly. We do full life care. Our providers deliver babies that are at the local Providence Hospital, all the way till end of life care, and we have a dental clinic on site as well. So just a little bit about us as a health center, and I'm happy to, of course, answer any other questions, but I know a lot of people on the call know the amazingness of health centers. Next slide. So I was fortunate enough to, in Anchorage Neighborhood Health Center, was fortunate enough to participate in the innovation lab that Seth just spoke about. And it was so wonderful to be a part of a group of organizations talking both about the incredible work we do every day, and then also thinking about what the bigger impact of what we're doing is in the community that we live in, and how we can better talk about that, and how we can better connect with others that are doing that. And so I'll just talk a little bit about a specific project that came from that work that we're really proud of. And thinking about the vital conditions framework and what's at the center, that idea of thriving, we immediately recognize, as I spoke earlier, to our diversity as a community, that there might be different definitions of what thriving is, and we needed to really ask some more questions and connect with communities here in town. So, and we already had surface level connections. Certainly, we already refer to lots of places in town and coordinate with them, but we wanted to try to approach this with that framework of vital conditions. So we reached out to our partner, the Pacific Community of Alaska, which works to develop and strengthen Native Hawaiian and Pacific Islander communities throughout Alaska, which is a sizable population, and talk with them about what their experience is with health, because that's what they're focused on as an organization in that community. And we learned a lot. We learned a lot about what we how we were thinking about health and how they were thinking about health, or how they were approaching it, what they felt were barriers. So we started off with just sharing some data, because they wanted some data, and it's always a nice, easy way to start a relationship. And what we saw was that there's a very high rate of no-shows among our patient population, who are Pacific Islanders and Native Hawaiians, and that was interesting, and we didn't know why, and we wanted to hear what Pacific Community of Alaska thought. And then they looked at some of their data, and they talked to their communities, and we really worked together to try to think about some specific interventions that might help and connect, because we recognize that a lot of this was about a community feeling safe and welcome in our health center, or in any space in our town, and how can we think about that in a bigger way. And so we've been working hard on this, and it's really just so much about talking. It's really so much about creating space for a conversation about this, and how can we do a better job? How can we as Anchorage Neighborhood Health Center do a better job? But also, maybe we're doing a fine job in the way we're doing it, but they just don't. But this particular community doesn't even know that we're doing it, or how they can start being a part of it. So with this work, we've seen some improvements, as you'll see in the slides, and we're really proud of it. But I think the best outcome is really the relationship, and having a stronger relationship with the Pacific Community of Alaska. And just this fall, they released a big data study of health-related data for their community here in Alaska, and it was so wonderful and compelling. And this was their journey. They were on that anyway, but it is so we are so honored to even be like a footnote in that story, and to have some of our data in their overview of what it looks like to be a Pacific Islander here in Alaska in terms of health. So I feel like that's a terrific outcome right there. And then finally, I'll just talk about there's a bigger picture to this. My background is in public health, and I grew up here in Anchorage. And so when I heard this vital conditions framework, I was just so it was very compelling to me, and I started talking about it all throughout the city. I talked about it to my partners. I used to be in social services. I talked about it to our mayor and to our governor and to just anybody who would really listen. And what I found is that so many people were already thinking like this, and they were already thinking in these terms, but having this framework, or a framework like this, where they could hang those ideas and we could see how we're all thinking about it in the same ways, has just been eye-opening. And we've had a number of conversations with leaders across Alaska, sort of based on the seeds that I got from this innovation lab. And so I can't wait to see what grows next, and thanks for your time.
Great. Thanks, Lisa. Um, I am going to hand it over to Christine and move us along, and then again, we can have more discussion in a few minutes. Christine.
Good morning. Oh, well, for me, it's morning. Good afternoon for some people on the West Coast. Thank you for carving time out in your day for this. I'm going to be really brief so we can get to the questions. We are a federally qualified health center. Like you, Lisa, we celebrated over 50 years. We were founded actually as a women's health center. It was above a candy shop, kind of in the radical 70s, where the founder hitchhiked across the country with a draft manuscript of our bodies ourselves. And long story short, she's still involved in our organization. You can see our metrics there, and you can learn a lot more at our website. We have a very robust website with lots of resources. I think the only thing I don't have on there is for us, we do not have the diversity. We serve primarily Caucasian and the Latina community, with probably 64% of our population identifying as white. It's probably higher than that. That's self-report. Next slide. And then just talking about how we came to embrace the 7 vital conditions. So I lucked out, I've been with the organization, I'm the Chief Alliance Officer, and I've been with the organization for 5 years. And when I came on, they were already very committed to what we called social determinants or social drivers. And we have a care model that is whole person well-being. We're a patient-centered primary care home. That was what I stepped into. We've invested heavily in community health workers. For many years, we have over 20 community health workers on staff. We embed them in partner agencies. We embed them in our clinics. So that's a piece of it. We have leadership that has supported this idea of systemic change, that they're willing to say, okay, we serve Southern Oregon. And, I think on there, I think we have 16 or 17 sites. We have a very long spread out kind of footprint, but they're interested in what we're doing in Southern Oregon, and yet total value of care. So partnering with like Oregon Department of Human Services and others, so that the thriving isn't, that we can move towards thriving and better use state resources. We have close relationships with those key government agencies, and I'll go into that later, as well as our CCOs, our coordinated care organizations for people who are in healthcare. And then there's a commitment to embrace education and be stewards. And what that means is that time is allowed for us to give presentations on the 7 vital conditions to various partners, to attend meetings, to really be kind of that voice. And I'm going to just stop there, Anna, because I know you have questions and we want to get to the other part of the program.
Thank you both. It's really helpful to sort of understand the context that you're coming from, and a little bit about the work. So I'll actually start with you, Christine, and have you go first. And the first question is, what has the Vital Conditions Framework made possible for you and your health center?
Thank you. It's allowed us to collaborate with, as I mentioned, government and larger institutions. So as a result of using it, we've been able to convene the community at a local level, but also at a regional level. When I think Seth had in his presentation that quote, what I say is that you can it's easy to convene around the 7 vital conditions because no one argues with it. It's never divisive. No one has ever looked at that framework and said either I don't get it or this, there's nothing, no one argues with it. So it's just easy to kind of, and everyone in the different areas that are not in healthcare, because we work in other spaces, they see it as foundational to thriving and wellness. So I would say it's given us the opportunity to work on upstream solutions. So people understand that day to day we serve people. And so we employ the 7 vital conditions at an individual level. And I think, I can give examples of that later, but that means that we help patient members get to appointments. And we do that by bus passes and purchasing bicycles and gas vouchers, fuel vouchers in a million ways. Like, we help people. And there is energy to say, yeah, that's great, but let's solve the transportation issue for particularly rural Oregonians. So there's that and a lot of energy of we don't want to keep just doing these types of things. We want to solve the underlying issue. I think I'm going to save other things I want to share for the other questions and give Lisa a chance to answer that question.
Great.
Get up me there. That was great. That was great to hear. It's so amazing, and I would say that for Anchorage Neighborhood Health, what the vital conditions framework has really made possible is just it's conversation more than anything else. I mean, listen, the work of organizing and thinking about the big picture, right? That is certainly, we're trying to do so much, we're trying to do our piece of that part, and so many partners across our city and our state are as well. But I think it's just, this is like a doorway to be able to talk with other people about things, about this bigger work that we have, and I think I love how that quote that Seth had as well, Christine. I think that it's easy for people to get behind. In Alaska, we are we are like historically a very red state, but also very libertarian, and in lots of ways. And I think that, and I bet Christine connects with that. And I think that so we just have, but I would just say we have a diverse political landscape more than anything else. And so this isn't about politics, right? There's nobody that I know who doesn't want to live in a place that is thriving and where people are connected. Everybody wants that, and everyone has different definitions of that. So this allows us to have a conversation about what that means to people.
Great, thanks, Lisa. And Christine, I want to get to your specific initiative. So I'm going to ask you the question next, which is an example of a collaboration that helped you to move beyond meeting urgent needs to building long-term solutions for well-being.
Yeah, thank you for that. I want to say that the first thing that did is that we were one of the 6 health centers that participated in the innovation lab that the 3 agencies brought together, and that supercharged our efforts. We were already working on things, but I think the commitment for leadership to participate in that gave it momentum, and as well as gave us stronger tools. So that was a piece. We did, even prior to this, because I've worked around social drivers for a long, long time, we did start something we called the Transportation Initiative for the Upper Rogue. We were inspired to do that because we have a broad screener that our CHWs use, and we use it every time someone walks in the clinic. There's a single page where they can circle things that you would all recognize, things they need help with. And transportation repeatedly came up. The other things that came up, that we have had the same top 5 for as long as I've been here, and it's been dental, mental health, transportation, housing, and I'm not thinking of the 5th one right now, but it's always the same. Sometimes food shows up in that, but it's usually not even in the top 5. So transportation, we decided to take on, and I'm happy to share kind of how it worked into the vital conditions. And I want to be practical, because I think sometimes when we look at a framework, it feels theoretical. So it's like, how do you then take that and get the energy to actually solve the problem, get agreement to solve it at a more system level? So I don't know if you want to bring up slides or where you want me to start on
Yeah,
this.
bring the slides up. I think they're helpful.
Okay. So, we had this basic understanding around transportation, and I think what came up is this idea that reliable transportation is its own thing, but it's actually essential for learning, work, basic needs, and specifically for belonging. This came up a lot when we did this, that when people wanted a car or vehicle, it was often because they needed to connect with family. So it wasn't just to get to the grocery store, to medical appointments. So And I can share, I mean, there's a lot of information about this particular project if after this people are interested in transportation and want to know how it can be done. So we worked with the community on this. I will say the precursor to this, because I want to offer something very practical for folks who are interested. When I came on with Rogue, I immediately started planting the seed that I wanted an AmeriCorps Vista volunteer. Because I'd had two prior. I built a 340B pharmacy with one. I built so many neat things. I had a Jesuit volunteer when we built a community health center inside a public health department. So I wanted that, not even knowing for sure yet what they were going to do, but knowing that if I wanted to do something, people inside the organization are often taxed. So if you have someone that can really work in the community on something like that, it would do that. So I would say the reason why we were able to do this is that we have an AmeriCorps Vista volunteer dedicated to this effort. And then you can go to the next slide. So a lot of what we did, and I'll get to the funding question later, but what I want to say is that the core of this with the communities that were very small was not actually around transportation, it was around economic empowerment. It was this idea of that some of the things that we are going to help support the community in building in their own community would be things that would over time economically empower that community. And I'll give you an example, two examples. One is they wanted to reopen, they wanted a business that was repairing cars in their community. They wanted a gas station opened again so that when people came through, it would help with tourism. So everything we did was around what that community saw for their vision. And it was transportation was part of it, but originally in a lot of the application was around economic empowerment. And we actually got a USDA grant for that. So I think I just don't want to take up too much time.
Okay, I think there's just one. Oops, yeah. Get my computer to work. Yeah, we talked a little bit about.
We did, and I can talk about, so I guess the thing I'll say about this kind of jumping ahead rather than going through all the slides, when you asked your question, urgent needs versus building long-term solutions. I feel like we're still not in the long-term solution because we know what the long-term solution is we knew that what we want is a rural transportation district. We figured that out after the first year and we can't make it happen. We did get close. ODOT, that's Oregon Department of Transportation, called out rural transportation as something they wanted to fund. And we're under a huge budget thing, so it's not going to be funded. So what's the closest thing to the next term? It's not necessarily a long-term solution, but it's a long-term benefit. And that is building programs that the community sustains to solve their problem. And that is, they want their vehicles to work. They want their own vehicles. That's the other thing we found. They don't want bus service necessarily. They want their own vehicles to work. So creating programs and such, and they wanted a private ride share program that was more like a community supported Uber, where neighbors are helping neighbors. So I feel like we're working towards that, but really if I had my druthers, if I could do anything, I'd want the rural transportation district. So that's what I want to say is like, so I think we're in the middle still.
Oh, sorry. So we can talk a little bit more about that. We're rapidly running out of time. I knew we weren't gonna have enough time. But Lisa, and Christine mentioned this a little bit, but have you been able to sort of gain support or funding or new partnerships or new opportunities for the work, sort of using any of this in the work?
Yeah. I feel like, hearing Christine's story, it's incredible. And in that innovation lab, there's so many stories that are incredible as well. And looking at the chat, I see that. And in some ways I feel like Anchorage Neighborhood Health Center is such a baby in this. Like we're just stepping out. We're, but I will say that, you know, vital conditions is the conversation. It's doing the work. So this innovation lab pushed me to, because I was so enthralled by it, to talk about it to a lot of people. And then what I heard from the leaders across the state was, oh, we already are thinking like this, we call it this, or we do this. There's a similar model for justice, but just this word is at the center. It's like thriving, but it's a little bit different, right? And it helped. Sometimes in healthcare we can always think health is the most important, but that's not what people feel. And thriving, we even could be defining thriving with health, but that's not how they define thriving. It's like health is only a very small piece of it in how they define it, right? um, I would say a really recent example of alignment was because we had started having these conversations, and some amazing leaders in town from like big foundations and local government started having conversations. We were a group talking about this, and then the Rural Health Transformation Fund opportunity came up, and that group was a natural group to talk about, wait a second, how do we want to think about applying for money like that in Alaska? Because it's so easy, and I bet many people on this call know that it have experienced this. It's so easy to make it be about one or two specialized project, or each little town or each little region's project, which are all really important. My projects like that are very important and they mean a lot to me. But also, we had a forum and a place to have a conversation about what's the big picture and what we really want out of this. Like, what's the future vision that we see? And I feel really excited about that opportunity. I haven't seen the funds yet, but I'm excited that we're on the page of building towards a better future.
Great. Thanks. And Christine, the same question.
Around funding and partnerships, right? So I
Yep.
could talk about all of it. I'm going to talk mainly about funding because I think that's where people always get stuck. How do I do this? I agree, Lisa, what you were sharing is something that I've seen. We've had a lot of conversations in our effort to solve it at a much larger level. I mean, we are working with the governor's office, we are working with legislators, and it's not happening now, but I feel like that work remains. Like we have people who are willing to advocate on our behalf, and when things shift at some point, which they will, I think we'll be well positioned. So what we did, there's a couple ways that we've been able to get funding. So first of all, having a dedicated person. Secondly, we did get some initial grants. We had some key partnerships. We got the eye of the Oregon Health Authority heard what we were doing. They became interested. Our CCOs are interested. So they both gave community funds for very specific things to us. So they funded, like our rideshare coordinator programs, the two CCOs, very small funding, I'm talking like $15,000 here, $8,000 here, but they are funding it so that we can get those things going. And then we started something we called the Success Fund. And we are an FQ, we receive money from HRSA, but that's actually a very small part of our budget. We mostly get our money through payments through the Oregon Health Plan. And we're also a community health center that's a nonprofit. So we don't usually go out and raise money, but we do once a year do an appeal and we ask people to fund our success fund. And we design that around the vital conditions. So we have 3 areas at which people can participate, and we raise $30,000 to $50,000 each year. And we use that money to fund families and individuals around vital conditions. And we have and that has been hugely successful. So I have so many cool stories about the things we've been able to do by having such flexible money that my community health services team, our community health workers, has access to that. So it's everything from, buying someone a bicycle to repairing someone's car. There's a lot around transportation, but we do things around housing with that success fund. We've been able to get people a few times into homes, which has been huge. We've been able to get people into a permanent apartment or senior housing with being able to pay for things. So I would say that was one of the ways that without bigger money, we feel like we can help our own patient members. So happy to
Great
take
examples.
questions.
Yeah. Yeah, we've got just a couple of minutes left. Are there questions? I haven't been able to see the chat, so or if folks want to come off mute, you're welcome to. I see there'll be some connection after. That's good already. We don't have questions. Then, given the time, I will. Oh, wait, there's a question. Are you able to share any documents related to your fund?
Sure.
Yes. Okay. So share out some of that afterwards. Okay.
I can more importantly share with you how we built it, because that's more useful usually.
Great. Thank you. So with that, I want to just leave a couple minutes for. Oh, I see a question. Walt.
Well, it's
Go
really
ahead.
just wanted to sing the praises of all the stories that are just got shared here, and just wanted to bring attention to something I just put into the chat. So, Lisa, you just described the kind of forum and that the conversation is the work, and we're very much about that. And the Thriving Together US initiative that I launched in partnership with Rippel and everybody else last December is about doing that, but it's really for a civic innovation hub kind of format where everybody's interest in thriving and however they define that. So anyway, I just wanted to say thank you very much for your stories. It's just beautiful, and I don't know if you wanted to riff a second longer about how the conversation is the work, and I don't know, you might repeat yourself, but it was music to my ears to hear that.
There's something else I might say. Thanks for I appreciate that, and that sounds amazing what you're doing. Here's the thing I found. So so my background's in public health. So immediately when I heard this, I was like, oh, social determinants. This is just another way to talk about it. Love it. And then I worked before this in social services. I led Catholic social services here, and then I did this job. And what I found is all these different languages. And even in vital conditions, there's jargon. It ends up being jargon because it's easier for us that know the model to talk about it. But the less I use jargon, the more I just talk about it in real generic terms, the more cohesion I found, right? Even the word thriving becomes jargon because we use it so much sometimes. So it's like taking the time to say, like, this is what I think of as thriving, or this is what I heard my mom talk about it. Like, how do you think about it? That's something that I've really learned so far in this work. I don't know if you've experienced that, Walt, but that feels really true to me.
No, I think that you're exactly right. So much of the work has been having it, and now I would say in our community, people use words like belonging and thriving in all sorts of places, and it inspired. Last year, we had our main event a week after the national election. So knowing that we were going to be convening 300 people that were going to all be feeling different ways, we chose belonging and civic muscle as the theme, and we had a professional storyteller as our keynote, and we did a storytelling workshop in that afternoon so that people could connect and understand. And I just knew I would need someone who could really hold the space. What that did is it started something that's not even us, that we did join or die screenings after. And now fast forward, we are here, 9, 10 months later, and Johnny Powell's coming to speak in Ashland. And there's a whole group, 600 of us bringing him because this idea of that connection that we need, our brains are wired for connection, that we must connect, that social isolation is actually a genuine health risk. That's all now kind of accepted in a large part of the people working in our community because we've been having these conversations, right? And we're a host for having those conversations.
Awesome. It's amazing.
Yeah. Thank you both. We are at time, so I'm going to say if you saw Sierra's note in the chat, please fill out the feedback form. We'd love to hear any and all feedback and thoughts. We will be sharing out resources, as we said, so more to come. And we will be closing our season of Toolbox webinars in November. So stay tuned for more information about that, and we hope to see you then. And thank you so much to our speakers again for joining. It was really, really, really great to hear the work and exciting, as Lisa said at the beginning. So thank you all.
Thanks, amazing Rippel.
Yep, thank you for the privilege.
Thanks. Thank you.